everyone, welcome back to the channel. My name is Princess Kevin. It's the first time of you tuning in. You are welcome. But if you're a regular viewer, you're a regular subscriber, thank you so much for always tuning in. So in today's video, we are talking about more interviews, and I want to particularly address that the tell me about yourself question. So we know that once we go to any interview, the first question, one of the first questions, if not the first question that they ask, is tell me about yourself. So that's what I want to be addressing. So in case you have not watched the other video I did telling you guys about how my experience in an interview was, please just click on the video and then go and watch, because so that you can understand my train of thoughts and just follow along. So let's get right into it. In that video, I talked about how they asked me the question, tell me about yourself, and I answered it in an okay way. I would give myself a pass mark. But then coming back, I made some research about how to answer that question very well, so that you will make sure that you just did what was right. After the research, I knew that I would have answered the question in a better way, though I still did okay, but there was a better way of going about it. So that's what I just want to address in this video. So the first thing that you will do when they ask you the question, tell me about yourself, is first of all, you thank them for the opportunity of the interview. You must not say a lot of things. You can just make it simple and short. You can say something like, thank you very much for this opportunity to be interviewed by this firm, by this hospital, by this organization. Simple, nothing complex. After that, it's important that you tell them about your skills and your qualifications. We know that they already have your CV and your application letter, but it's important to make sure that, let's say you can say something like, I'm a registered BSc nurse, or I'm a registered midwife, as the case may be, depending on the kind of nurse that you are, with a strong foundation in patient care or maternal and child health or community health promotion. You can also add that my experience has helped in training me in particular areas relating to giving compassionate health care in a hospital setting and also in community setting. I'm always putting this community setting just in case you are applying for a job in a company or in a community setting, in a public health setting. If you're a public health nurse, please put that community health setting is important. You can also add that say something like, I'm skilled in assessing patients' needs, helping in educating the public on their health, and also assisting in safe delivery or helping out in safe delivery, as the case may be, depending on if you have helped out, depending on if you have carried out a labor before by yourself, or if you have helped out. Just fill in the blanks and know how to tweak it to meet your own need and your own qualifications. Another thing I advise that you should add is that you should give an example of how you helped your former place of work. Remember in that video I told you that they asked me what was my impact in my former place of work. So this, just adding this, will also help. You can say something like, depending if you're just a nursing student that just graduated and you have not actually worked in a hospital in terms of an employment basics, you can add what you did in the hospital as a nursing student, how you helped the hospital out, how you helped the patients, stuff like that. Just add it. Do not say anything. You have to say something. So you can say something like, while I was at my former place of employment, I helped my team in attending to the patients on a timely basis. Every patient was attended to at the right time. One, you can also add that you helped in communication between yourself, that is between nurses and the patients. You also help in communication between the patients and other healthcare workers and their relatives. So just to relay the right information across and make sure that the communication is running smoothly. Stuff like that, simple and short, but you're saying something that is important in any organization, in any hospital where you're going to be working at. You can end this question of telling them about yourself by telling them what you will do and how you will do it if they give you this particular position you are applying for. I know that it's, some people might say it's not really important because you will have your what they call it, your letter of employment, and you already know the rules of a nurse. But how you will do it is also important. Like, if I'm employed or if I'm selected for this position, I not only plan to bring in my clinical skills, but also a strong sense of commitment, teamwork, because I really value our organization or hospital, and I want to add a real value to is fair, something like that. If you say all this, I'm very sure that at least the question of tell me about yourself, you would have answered it very well, and then you'll just be worried about the health or medical related questions. And if you prepare, like I told you in the former video I did, research about the organization, if you know what the organization is about, if you know what the hospital is about, the kind of cases they mostly handle, it will really help you in answering your medical related questions or your health related questions. So guys, that is it for this video. I hope you got one or two out of it. If it was helpful to you, if it was useful to you, share it to your friends, share it to your nurses friend, or anybody that's in the medical field. And I'll see you guys in my next video.